So thyroid storm. Thyroid storm. Why do I need you to learn about thyroid storm? Very, very important. Very, very important for your NCLEX program. Very, very important as you prepare for your NCLEX exam, right? So remember we said that what produces the TRH? Can somebody remind me? What produces the TRH? TRH.
Hypothalamus.
Okay. And what produces the TSH?
Anterior pituitary gland.
Beautiful. And what produces free T3 and free T4?
Thyroid hormone.
Thyroid gland. Okay, good.
Thyroid gland, sorry.
Yeah. Okay. So when we say thyroid storm, what we mean is that, we are already talking about hyperthyroidism. We are already talking about the fact that the thyroid is overproducing, right? Now, if that overproduction gets to a crisis level, or if it gets out of hand, they will call a thyroid storm. It's like a storm is coming, right? And then they will give you weather warnings. A storm is coming, a storm is coming, a storm is coming. Thyroid storm or thyroid crisis. Okay? Now, thyroid storm or thyroid crisis is a life-threatening emergency. It can threaten the life of the patient. And it is as a result of extreme hyperthyroidism. Extreme hyperthyroidism. Okay. So, why do people get thyroid storm? Number one, if they have long-term untreated hyperthyroidism. So if they have hyperthyroidism which has not been treated for a very long time, and then it can also happen in patients who have hyperthyroidism already, but then they get an infection like a pneumonia, like pyelonephritis, like sepsis, okay? Then their thyroid gland will go out of whack and it can cause some trouble. It can also occur in patients who have trauma to the body, because trauma puts excessive stress on the body. And it can also happen in patients who have manipulation of the thyroid gland. Manipulation of the thyroid gland itself. If the thyroid gland is manipulated in a patient with hyperthyroidism, it can lead to a thyroid storm. Let me say it again. So thyroid storm can occur in patients with untreated hyperthyroidism. It can occur in patients who have hyperthyroidism and get a superimposed infection or trauma, or they have manipulation of the thyroid gland. So for example, if they have thyroid surgery and the thyroid is pressed, then, yes, that can lead to a thyroid storm. Now, how will the clients with the thyroid storm present when you are doing your nursing assessment? We've already talked about them. We said that the temperature will be high in hyperthyroidism, tachycardia, high blood pressure. So that's what is going to happen. Their temperature will be high, their pulse rate will be high, their blood pressure will be high, they may have abdominal pain, they may vomit, they may have diarrhea, they will be agitated, they may have tremors, shaking of the hand, shaking of the hand, shaking of the hand. They may be confused, confusion, and they may have even a possible seizure. So please, you need to know, how will a patient with thyroid storm present? How will a patient with thyroid storm present? High temperature, high pulse rate, high blood pressure, systolic blood pressure will be high. They may have abdominal pain, nausea, vomiting, diarrhea, agitation, tremors, confusion, and even possible seizures.